access to mental health care is a problem, not only here in the United States, but actually, frankly, in developed countries.
It's hard enough to get mental health treatment in the US, but it's even harder if you're not white. Studies show that racial and ethnic minorities are significantly less likely to receive mental health treatment than whites.
A los pocos meses de que mi hija había nacido, quedé embarazada de mi segundo hijo sin haber tratado mi depresión. Quedé embarazada también con Joshua, pasó lo mismo. Nació Joshua, seguí yo con mi depresión a un punto de que intenté quitarme la vida.
Mental health is an extremely prevalent issue today all over the world. According to the National Alliance on Mental Illness, NAMI, about 40 million people suffer from mental illness in the US every year. This means that 1 in 5 adults suffer daily, with nearly half of them not receiving treatment. In this segment, we will be discussing how and why first-generation native Spanish speakers seek and receive mental health care, and if they don't, why that is. I want to discuss if there are cultural and linguistic barriers that prevent those populations from seeking mental treatment. I'm Kayla Munn, and this is my segment of Things to Think About, and we'll be discussing the topic of the relationship between first-generation Hispanics and the seeking of mental health care.
Just like physical health, we all have mental health. It's our feelings, our thinking, our emotions, and our moods. She then said that feeling down, angry, and stressed is a normal part of life, just like it's normal to feel happy, confident, and carefree sometimes.
The term mental illness refers to a wide range of mental health conditions that cause disorders that have an effect on moods, behaviors, and thinking processes. Mental illnesses are common in the U.S., with 20% of America's adults suffering daily.
So when you look then at the mental health system, you discover that while Latinos make up 30% of Medi-Cal enrollees and over 40% of people eligible for Medi-Cal, they represent only 10% of the Medi-Cal recipients that are receiving public mental health system services. So,
according to Mental Health America, 15% of the Hispanic and Latino populations combined in the United States had a diagnosable mental illness in the past year. Only 36% of this group received care, falling behind Caucasians by 50%. American Psychological Association went on to note that while 70% of non-Hispanic whites return for a second appointment after initial visit to the psychologist, only 50% of Hispanics do. These numbers show that there's an obvious lack of Hispanic and Latino Americans seeking mental health treatment. For this project, I will be comparing statistics and responses from different studies found on different sources. Alongside the comparisons, I will be interviewing a Spanish-speaking psychologist about her experience with Hispanics seeking mental health care in the United States military. Before discussing all of this, I would like to outline a few research questions. First one being, why is it that first-generation Hispanic immigrants do not seek mental health care in the U.S.? Second, is it possible that Hispanic immigrants are not comfortable with a therapist? Third, are there any cultural or linguistic barriers in the communication of immigrants with their therapists, and how does this affect accessibility? Fourth, is there evidence that there is a difference in care between those who speak the same language as their mental health care provider and those who do not? And the last one, is there a possible negative stigma in the Hispanic culture that encourages those in that community to not seek mental health care? When we look at articles and studies about Hispanic people seeking mental health care, we find that many of them do not seek mental health care to begin with, and many of them do not continue as compared to other races such as Caucasians. Now the real question is why? After doing some digging, we can come up with some reasons as to why Hispanics do not seek mental health care in the first place. This can have something to do with the general culture of Hispanics and negative stigma of mental health care in the Hispanic community. This could also have something to do with the language barrier between the mental health care provider and the patient, and even possible financial barriers.
Loca, exagerada, you're attention seeking, llorona, just get over it, crazy, stop being a crybaby, don't be so dramatic.
According to a study that was done by Dr. William Vega, more than half of depressed, low-income Latinos in Los Angeles said that they think depressed people are not trustworthy and they would not be willing to socialize with someone who is depressed. This self-stigma also contributed later to them not being willing to take medication or show up to regularly scheduled appointments.
Well, I think as like Latinos, if we have a problem, we just speak to our family or we kind of swipe it under the rug.
It seemed more so, like, for lack of a better term, more of a white thing.
Even when we speak to our families, we're told to be super strong.
Get over it is the one, like, you hear that a lot, I think.
I realized that mental illness runs in both sides of my family. As a culture, Dominican people just don't discuss. And I think maybe I'm generalizing, but I think a lot of people of color just don't discuss.
The negative stigma surrounding mental health in the Hispanic community also ties into their culture. Some experts suggest that religion is very important to the Latino community, and some Latinos first turn to their church or even to the folk healers known as spiritualistas for help with mental health problems, even more so than American culture as a whole. Latino culture values self-reliance, which can discourage people from talking about their problems, says Jane Delgado, PhD, a clinical psychologist and president of the National Alliance for Hispanic Health. They feel that they have to resolve issues themselves, she says. They don't want to be a burden. There is also a language barrier between Hispanic immigrants and those who provide care. According to this study done by Psychological Services, Spanish-speaking clients often feel less comfortable sharing personal information with this English-speaking therapist, even when an interpreter is used. Therefore, the language barrier not only affects comfortability with the therapist, but also Spanish-speaking clients may shift from English to Spanish when recounting emotional experiences, and they may represent themselves differently depending on the language they are using. So the question would be, why wouldn't they go see a Spanish-speaking professional to get help? This would seem like a simple solution, however, there is a problem.
Hice varias llamadas y todos me contestaban en inglés y todos eran para grupos de apoyos en inglés. Yo andaba buscando apoyo para mi esposa, que ella no habla inglés, habla puro español.
There is a shortage of Spanish-speaking health professionals, especially psychiatrists, psychologists, and therapists. There are only 29 Latino mental health professionals for every 100,000 Latinos in the U.S., compared to 173 non-Hispanic white providers per 100,000 non-Hispanic whites. Therefore, it is possible that this lack of access to Spanish-speaking professionals is why there is a decrease in Spanish speakers returning to receive treatment or even seeking it to begin with.
Most Latinos don't have adequate or consistent access to healthcare in this country. And that's because there are serious economic barriers to accessing mental health resources.
Then there is also the financial barrier that many Hispanics face in the United States today. According to Health.com, Latinos have the highest uninsured rates of any ethnic group in the U.S. In 2007, nearly one-third of all Latinos had no health insurance, compared to 10% of whites. Moreover, a 2006 American Psychological Association survey found that only 41% of insured Latinos had mental health benefits, compared to 65% of whites and 63% of African Americans. With Latinos having the highest uninsured rates, it makes sense as to why they would not seek mental health treatment, especially when an average cost per therapy session can range from $75 to $300, depending on where you live. I also interviewed Dr. Ramirez Vigil, a psychologist from Puerto Rico who now works with the U.S. Air Force. However, because she works with the U.S. Air Force, she does not experience any financial or language barriers. This is due to the people in the Air Force being required to learn English and having equal accessibility to mental health care. However, from her experience in Puerto Rico, she was able to comment on the outlook on mental health from Hispanics. She said that she sees the most difference in seeking mental health treatment between Hispanic men and Hispanic women. She attributes this to machismo, which according to Webster Dictionary means a strong sense of masculine pride. She said that this affects Hispanic men greatly and causes them to not want to come into therapy because it hurts their pride as a man. Compared to Hispanic women, they do not feel as much of a sense of losing pride when going to therapy, so they are more likely to go. She noted that especially first-generation Hispanic immigrants should go to therapy because they experience a huge transition and can sometimes lose contact with their friends and family back home, which can cause some mental health problems.
And when you're a Hispanic and you talk about mental illness, sometimes we tend to keep things under the table, secret, and that's wrong because today there is help for everyone and you are not the only one who suffers from this.
In conclusion, from the research we have done, we can see that many Hispanic immigrants do not seek mental health care as often as they should. Some reasons for this may include the general Latin culture, the negative stigma in Hispanic communities, language barriers, and possible financial barriers. However, more research needs to be done because this topic is very understudied. If after more research we find that the negative stigma is a significant factor in Hispanic communities, then we should encourage more organizations to promote awareness of mental health in order to encourage more Hispanics to seek mental health care if needed. If there is also a significant factor of language barriers between therapist and patient, we should also encourage other organizations to provide incentives for those who do speak Spanish, including loan forgiveness programs or things like that. Also, there should be more multicultural training in order to help provide more comfortability between a therapist and a patient. Thank you for tuning into my segment on Things to Think About. Hasta luego.